Welcome, guys. Okay, so this week's clinical pearl is talking about the mini massager, and this is a great tool, and I will put it in the description of the video. Of course, you guys too. I'm going to send you these videos. These are good to look at, and then they go to all our TMJ subscribers, craniofacial subscribers. So, sorry, my glasses is so dark. I think I was outside, but okay. So the mini massager is a great tool for craniofacial, and so it vibrates, right? And any vibration to a joint or to muscle, it's good. It helps to inhibit tone. It usually feels pretty good. So I'm going to show you a few things that I do. So there are a few different tips with it, and I generally use the dome tip, this one here. And by the way, we sell these. I probably sell 2 a week of these to our patients. So we mark them up, I think we double the price. Anyway, but I think they're around 28 bucks with our markup. So a lot of our craniofacial patients buy these. All right, so let's kind of go through. The dome one is the one that I use more. In a previous video where I'll have a link to, I went through all the hand techniques that I do. So when I do that, first I kind of find the areas that are tender, and then I'll complement it with the mini massager. All right, so the dome area here is great for, the suboccipital area here, where this is kind of ground zero for headaches. Those small capitis muscles that are from the skull down to the top of the cervical spine. This area is very tender, can be a place for headaches. So relax. Yeah, just relax. So yeah, you can just go along here. It's not rocket science. And then same, I'll do the other side. I do this all usually in supine. I mean, you could do it in prone too, but generally I work with them in supine. So another good area, you can get around the temporomandibular joint here. Be a little careful. Remember, the tragus of the ear, just anterior to that is going to be the joint itself, okay? So just, as always, I like to be gentle, and then I might go a little bit more firm, and then you can go along the masseter muscle, along the mandible here. Yeah. Okay. Now, one thing that I really like is one day I was trying to get this up in here, and it was kind of pulling the hair, and so I miraculously had an enlightened moment, and I turned it around, and I just used the base. And I'm like, wow, this is great. Okay, so the base is very good to get into the skull, the temporalis muscle, and even up through here. And I tell you what, the patients love it. They're like, oh, this feels so good. Okay. All right. And even I'll use the base, if they're pretty sore and I just want to relax the area, I'll use the base area too. I keep some alcohol swabs, alcohol squares, and I just, after each patient, I just, sterilize the unit. And again, yes, you can use the base. I'll be honest, I probably use the base of the massager more than I use the dome tip, okay? Another area that's good is the sinus area here. You can use the dome end and just go in here and just get just below that zygomatic arch. Again, this is very good to kind of open up the sinuses. Usually people say, oh wow, I can breathe better after you treat that area. The malahyoid area here, this is a good area here too to hit as well. And I'll even do a little bit of the pec area here up through here. All right, so that is your clinical tip, the mini massager. Works very well. This is something I strongly encourage you to integrate into your routine of your craniofacial patients. Even make a little bit of money and stock some of these. And oh, one other thing. When you have a patient with trismus is when the jaw is locked. And say, you know, I always love to use the tongue depressors, and if they're only opening 25 millimeters, we're trying to get to like 34, and you use the tongue depressors and you slide one in. Well, usually it gets pretty painful on one side, the restricted side, so I give this to the patient, so take this, and so I want you to just take it, Marvin, and just kind of massage this area right here. Yep, just like that. So while I'm sliding into the sticks, they will massage that area that's like, it feels tight and it's pretty uncomfortable, and it allows me to go a bit more aggressively with increasing opening using the tongue depressors. And so this is, and they all love this too. So when you're doing any patients with trismus or the jaw is restricted and opening and you're kind of, you know, pretty strongly trying to stretch the jaw, give them this and tell them, okay, where it's hurting, just work that area while you're stretching the joint. Okay, well, thank you guys for watching, and we'll be back on the next video.